Hi, I'm Dr. Janne Lynch, and today we're going to be discussing implants. If you find yourself in a situation where you have a non-restorable tooth, you have to get that tooth pulled out. Of course, that means you'll have a space in your mouth where you don't have a tooth anymore. The consequences of that would be that the teeth behind the tooth that gets pulled out would move forward, and the teeth that are supposed to bite on the tooth that's been removed will actually grow downward. I always recommend to my patients that when they have a tooth that is non-restorable, that they close the space with something. The first choice, the traditional choice, is a bridge, where you take two crowns and put it on either side of the hole attached to the two teeth that are there, and then you put a fake tooth in the middle. The other option that we are lucky to have these days is a dental implant. This is the Ferrari of dentistry. What it is a titanium screw that goes into your bone, and your bone fuses with that titanium screw over the course of about 3 to 6 months. Once that bone is fused to the implant and the implant is in your bone and it's solid, the dentist is able to go back in and put an abutment into the implant. Once that abutment is in the implant, the dentist is able to go back and put a crown on top of that abutment. So there's 3 pieces to what we call a dental implant: the implant itself, the abutment, and the crown that goes on top. They do it in 3 pieces in case you get into an accident or get hit in the jaw. That abutment can come out of the implant and it won't break your jaw. The interesting thing about an implant is it will never move orthodontically. So we don't like to do implants on children, only on adults who are done growing. A dental implant is the nicest choice because you'll be able to floss in between your teeth. With a bridge, you won't be able to floss between your teeth anymore because it's fixed to the teeth on either side. You'll have to floss under the bridge in order to keep it clean.